you know, 2023, 2022, 2050, next century. Many of us make some resolutions. Here's the resolutions I like to think about how you can be a healthier version of yourself. And put some thought into it. The team's put together a wonderful presentation. So let's talk about it. Next slide, please. You know, um, you see two pictures here. One is a person with a big bruise, and one is a person who may have a big bruise if he's not careful. And that's basically me on the far right. I'm trying to learn new skills. I'm trying to keep myself healthy because my future outlook isn't bright. What you see on the left is my brother, who came to visit over Christmas, and he fell down the stairs, has a big bruise, broke a few toes. He has increased pressure inside his head. He's starting to develop some memory problems, some gait problems. And my mother died of Alzheimer's disease. My dad had bypass surgery, also developed a dementing illness as well. And I'm starting to lose my memory. I think we're all starting to lose our memories. And so what I can say about what end up being in the nursing home, we actually spend the last couple of years of our life usually with illness. And once we stop walking, once we start falling, once we stop thinking, we end up in the nursing home. And so what are the steps you can do to be as healthy as long as you can? And I'm taking some steps over here. I'm trying a new skill here. I'm learning how to rock climb. I also notice I'm starting to develop a little bit of tremor. My wife says my gait is not as strong. So I'm actually going to start a physiotherapy program to help prevent falls. And I'm going to be going there at 6 to 7 in the morning on Mondays and Wednesdays. And I have a home program right now, and I'm making steps to be as healthy as I possibly can. And I hope you're making those steps too as well. Next slide, please. Here's really, really a really nice picture here. Athena and her dad. So her dad has had a weak heart, and he's had a heart attack, and his heart's getting larger. And Athena here has been working in our clinic and is doing a wonderful job looking after people. And so, how do you become healthy and be healthier over time is that you need to surround yourself with people that are making you healthier, and having family members and things of that nature. When I met her dad, he told me a story is that he's actually learned accounting. He took accounting 101 at Concordia University. This is where my dad used to work. My dad is one of my heroes. And if you ever get a chance to read our book, the whole book's dedicated to him. And he was talking to me that he remembers very few teachers from university. He remembers my dad. My dad taught a class of about 800 students in a big auditorium. That was way back when we were getting to big lectures. In the past, it was small class sizes. So they'd have these auditorium classes, and then they had these small breakout sessions. In fact, what I shouldn't tell you, but one of the things my dad told me as a joke is that, he had this microphone, and he had to go to the bathroom. And the only thing is he never turned off the microphone. So the whole class heard him going to the bathroom, and everybody had a good laugh about that. But the point is, look at your family history, look at your family tree, make preventions, and surround yourself with people that can make it easier to be healthier. And I also think is that what I learned is I read books on behavior modification, books on how to improve on health. And my thinking right now is most of us want to be healthy, but most of us don't want to work hard enough to be healthier. And I hope that will change because our healthcare system is in trouble. It's always been in crisis. It will stay in crisis. It will never be out of crisis. And the best way to treat healthcare is to prevent it from happening in the first place. So my plea to all of you is to think about ways of being healthier and do things to help our younger generation, because our generation has messed up the world. We need to fix it before we leave it. And I'm really proud to have so many of these young people working with us and making you and me healthier. So I thank you all. Next slide, please. Now, this is kind of interesting. Remember when the Berlin Wall came down? I thought this was the age of enlightenment. I didn't think we needed to have walls and people were going to get together and cooperate. And I was always a Star Trek fan, and I think one of the reasons we all love Star Trek is it showed um, people working together, exploring, and becoming better. Reality is we need walls, we need defense so we don't kill each other. So Canada is going to buy 88 brand new fighter planes at a cost of around 19 billion, and the life cycle of those planes will be 70 billion. That's the projected cost. And knowing most things, the way things are funded, the cost will probably be 3 times that amount. So a couple of things to think about is that we have lots of priorities, health, environment, everybody wants more. But right now is that one of our priorities is defense. And that's sad that we're in that state of affairs. But one of the things is I hope I can show you a good defense of your cardiovascular system, how to be healthier. And hopefully these planes will never have to be utilized, but I don't know anymore. And one of the things is as a society, we become more self-centered, we're less caring, we're less working together. And to get good health care, we got to work together. And so acts of kindness, acts of gratitude. I hope we all think about this and how to make the world a little bit better. So my plea is one way to make my cardiovascular health healthier is to be healthier and to share. And I hope you take advantage of all the things that we put together on this. Next slide, please. Some days I ask myself, are we really working together or are we working apart? And some days I feel I'm banging my head against the wall, and other days I'm so frustrated because I see so many things that are preventable. And I hope I can share that with you. Now, I'm not an expert at very many things. I spent 64 years of my life, or not quite 64 years, I'm getting there, but I'm going to be 64 this year. And I probably spent the last 50 years thinking about how to treat heart disease, cancer, vascular disease, and how to be healthier. And I want to share that with you. And it's complicated, so please take the time to work together on this. So one of the things is that we wrote that book, 30 Days to Healthy You, book I'm very proud of. And you mentioned that book has a couple of purposes. One, it's a dedication to my father, the nicest guy I ever met. Number two, it's a dedication to you to making you healthier. And number three, it's a dedication to the world because all the money collected for that book is to help others. And so please take the time to read, look at things, and do acts of kindness. And also do acts of kindness to yourself. Take care of yourself. So you saw my brother who fell and is having trouble, and you see me climbing. So climb to get healthier, and don't climb and don't just sit around and let cancer, heart disease take your lives. Next slide, please. So you see this list here. This is, and why do we put this list there? One of the most common causes of preventable illness is medication errors. I'll say that again. Medical errors are common, and prescription or medication errors are very common. And so you need to be part of the solution, part of the problem. I get it. It's a pain in the neck to keep track of things. But if you're going to rely on other people to do that for you, you'll get something, but you also make it more likely to have errors from medications. How many refills, who's prescribed what? During the pandemic, I took on the responsibility to prescribe almost every pill in or outside my field to help people. Now is I want to concentrate on the pills I know the most about and the ones I can help you with. And blood work, it's that, oh, I forgot the pandemic, I have no time and things of that nature. Is that you saw those fighter planes, is that we're going to spend about $20 billion for the planes and about $80 billion to maintain that plane. To maintain your health is that appropriate blood work is important. Now, right now is that we can try to send through Medjos, but it doesn't work for most people. We send things in the mail, but people lose things. Now we give people 2 requisition forms in the office. And basically, for some of them, we can talk about whether or not you should make extra copies. For many people, I think it is yes. And there's repeats on that. So it's really important that you keep requisition forms available, because I don't know when the next pandemic we're making counters to that. So, and I want to really give you and deal with your medications when I see you and know what you need. And I like to give you enough medications to last you for at least a year or so for chronic medication and use them all. So that means you need to know what you're taking, who's prescribed what. And when you go to your pharmacist, make sure that your pharmacist resets the clock for all the medications that we've given you, because I'll write for 100 days with 3 repeats. That's 400 pills. That's well enough for a year. Now, the pharmacist sometimes for the first prescription will give you 30 days, which is reasonable. But if you're getting blister packs, or if you're not sure, you gotta know when you're gonna be running out of things. I don't know of anybody who drives their car and doesn't pay attention to when they're running out of gas. And part of your gas tank is your medications. Now, there's a lot of information, misinformation out there. Ourselves, all our McMaster students and other doctors I work with, other people I read, I spend hundreds of hours reading, synthesizing information, and I try to share that with you. Now, these videos take a long time to produce, and they take a long time to go through, stop and start. But if you want to know something, you got to take the time to learn these sorts of things. So if I ever hear again saying, you never tell me anything, the answer is I tell people a lot of things. You have complicated issues. If you want, we can do once a year health review. You can come in, one of our students, and review your notes. If you want to, take a copy home. Lab information, you can get that online. Dynacare and LifeLab offers that. We have videos about this. Get some smart young person in your family to help you set that up. And many of the hospital systems are allowing you to go into the hospitals, look at that. Our EMR does not allow that just yet. I hope it does. It changes at some point in time. We started one time with this scrapbook, a red folder that people gave. I gave out probably about 10,000 red folders, and most people never brought them back. Some people still do. You should have a scrapbook folder. It could either be on your phone, but you should keep a record on you right now, and we'll help you develop that. So I'm going to encourage everybody, when you come to see me, is get some sort of book or pad or paper. And here's one of my health scrapbooks right off the bat, and keep it in some sort of binder and bring it to all your appointments. And so you'll never forget these things. And I hope that's part of your New Year's resolution, because it's very important. You get information from all sorts of people, I get it, but take the time to look at the stuff that we do. We have, how many videos do we have right now, Daniel? And I bet you, most of you say, I get the videos, and a few of you have seen videos. If you went to school and you got homework to do, and you did your homework 5% of the time, which I suspect most of you are in that area, I'll do them next time, you would fail. And healthcare is complicated. It's changing. We in healthcare spend time understanding information. We'll share that. You're not going to get that information in a physician visit. It's just there's too much information, too many medical problems to deal with. But it's better to actually read, learn videos and things of that nature. Then we can have discussions. And so that's the way I think the future is right now. And who to believe? All I can tell you is this is what I think. Share that with you. Take a look. Look at other people's things as well. But here's a perspective based on 40, 50 years of trying to work in this area, and glad to share that with you. Very few people have done this, and thanks to all these young McMaster students, we're able to do this. You should take advantage of this. And if you choose not to, that's your choice. But I think your health is too valuable to leave to other people. You need to be part of the healthcare solution, or be part of the problem. If you say, well, you should know my pills. I told you that last time. You're in for a rude awakening. Next slide, please. Now, people get medications from all sorts of sources, and you have to work with good pharmacists, good healthcare providers. But you are the central person. If you can't handle that, tell me about that. For some people, I get it; it's too complicated. I will take over for some of your medications, or somebody in your family will do so. Um, but I'm not going to leave my medications to somebody else to manage. I'm going to be part of that equation, and I hope you are too. One thing to find out, some family doctors like to write all prescription renewals. Some family doctors want the specialist to write the medications that are responsible. And so I think it's up to all of us to work together. So you should ask your family doctor, do you want Dr. Curnew to write your prescription renewals, or do you want um, uh, the family doctor to do this? So why don't you check that and be proactive about that? And really important is, how many renewals do you have left? It's like, and the answer most time, I don't know. Um, is that, if you don't know, how am I supposed to know, or anybody else supposed to know? And if people change the dose, change medications, there are so many times that people don't let us know. And also, too, if you changed addresses, you moved away, change pharmacists, change doctors, tell us, tell us more. I find this system very good because you have a lot of people looking in there, working together. If you notice, if you look at, we're looking at these fighter pilots, new jets that we're going to be purchasing. It's not the pilot that gets the plane into the sky; it's a whole team, and this is our team to try to get you on the right medications and maintain that. Okay, so think about: are you part of the solution or part of the problem? So this is not a communication issue. This is just a life issue. So I got a prescription renewal for a dead patient. And we'll all need to work together. And then during the pandemic, there was a patient who was on taking medication called warfarin, but goes for blood work. Now, is that so? This he couldn't get a hold of his family doctor, so he asked me to renew it. I did, but I don't measure INRs. Well, it turns out is that the person hasn't had this blood test measured since about 2016, and that's well before the pandemic. So, who's responsible? I don't care who's responsible. It's just getting it right and knowing how to work together right now. And so, if you're taking a medication called warfarin, you should know, and the patient did know they should get an INR. But for some reason, they never did it and they never thought about it. Or they thought that someone else was measuring it, but didn't know those values. Um, my assumption was that someone else was measuring it, and the other person probably thought I was measuring it. So you can see that how we can all work together. And one simple thing is you as a patient, you can actually go to labs and get results of blood work. And you should know. So if we're all looking together, you saw that picture really working together. So we need all to work together so we can be in a nice organized fashion. Um, uh, Tell us more. Now, many of you are keeping track of that. That's wonderful, but many of you are not. And one of the things is that we're always behind because we're losing about 1 to 2 hours every day checking medications. And because people say, well, the pharmacist is in charge of medications. The pharmacist is not in charge of your medications. You're in charge of your medications. The pharmacist is in charge of renew medications. And pharmacists can renew medications. They'll charge you a fee for that. And that's something you can certainly do if you like. But the pharmacist doesn't have access to your medical file at this stage. It doesn't know you in enough detail for many circumstances. And so we is that think about ways how we can all work together. And this is a great source of concern. So we can finish 2 hours earlier every day and everybody's happy. Because I want to give you your medications when I see you and make sure you're on the right medications. I don't want to do it on the phone. I'm not prepared to just send in medications blindly. There's too many errors. And if that's what you want, then maybe I'm not the guy who should renew your medication because I want to make sure the medications that we're prescribing are the right medications at the right dose, at the right place, right time for you. Um, and that takes a lot of work. And you should also verify that yourself. Enough about that. Let's move on to another topic right now. That's an important issue. So one of the things I want you to think about is that there's one on prescriptions. That's a long one. You should take a look at this. And I think one of the things is that the thinking process of prevention is taking a long time. We have videos from a few minutes to a few hours, and I get it. We're trying to summarize and be brief, but this is complicated. So I'll try to shut up and let the team take it away. Tell us more. So please take the time. And there's that search bar to find everything you want to. Take a look. And you can have our students help you. So here are the 5 questions I want to deal with. Write them down. Here's a test that was done at Dr. Curnew's office. What does that mean? I have this LP Lule of a 445. What does that mean? I look at that video. I understand partially what does that mean. I have this Pro BNP that was 5,000 or it was 50. What does that mean? There's a video on that. And take a look at the video, then ask the question. And work on that. There's so much to do is that, and then we can prioritize how your health is can be right now. So that's part of my health wish for you guys. I hope it comes with a big responsibility, but it also comes with tremendous gains. Next slide, please. Well, this is actually the PURE trial, which is an international trial by Dr. Selim Youssef and colleagues. And these are people who have cardiovascular disease. And basically, in this situation, we recommend aspirin, we recommend cholesterol medications, maybe beta blockers, blood pressure pills, diabetes medications, etc. But look in gray how many people aren't taking anything. Um, and so most people who have blocked arteries will take a combination of multiple drugs because the biggest impact on cardiovascular disease is the drugs that we use that in the past treat disease, now prevent disease. So, to say that less than 20% of people are getting properly treated with the right medications is something worldwide right now. So you can decide what category you want to be on. It's sad, but that's reality. And next slide, please. Um, and potentially and possibly preventable. I'm not saying we can prevent everything, but we can certainly make bigger aims of this. So people say, do I have to take these medications? You don't have to do anything, but you can choose to have heart disease. And The reality is that most people don't take the right doses, don't take them for long enough periods of time, and keep saying, I guess it's kind of interesting. Most individuals don't want to take medications. Most physicians want to prescribe medications. Why? Because they work. And we now have 5 randomized controlled trials from ischemia, courage, and Berry 2 and others that show that medications are better than bypass surgery or angioplasty at treating coronary artery disease. I'll repeat that. We have 5 big randomized controlled trials showing that medications are better at preventing heart attacks and strokes compared to procedures. And yet most people want a procedure. The best time to have an angiogram and angioplasty is when you're having a heart attack. All the other times, most other times is that the medications perform just as well, if not better, in most circumstances. And people say, fix my vessels. We can't fix your vessels, we can actually palliate your vessels. And and it's sad to see this argument going on every day about this. So I take the highest doses of 2 cholesterol medications, and I'm thinking of going on to a 3rd one by injection the next little while, because I want to live a long time. Next slide, please.
Thanks, Daniel. So one of the, we heard the stat on the last slide where only less than 30% of patients are on the right dosage. And one of the trials that Dr. Curnew kind of told us to take a look at was the STRONG HF trial. And just in a quick summary here, they split up 1,000 people, around 500 in each group. One group was given the usual care, so like how much, what dosage they would normally get, whereas the other group would get what's called a high intensity up titration, which is just a gradual increase of the dosage of medication to a point where it's considered optimal. And one of the findings was, the primary finding was that patients with heart failure or HF had a reduced risk of 180-day death or reoccurrence of heart failure readmission compared to the usual care. And it indicates that, as we see in the stats, only 15.2% of the patients with the up titration had a rate of death or HF readmission compared to the 23.3% of usual care. That goes to show the importance of, as Dr. Curnew was saying, medication as an intervention compared to other treatment plans. Any thoughts on that, Dr. Curnew?
Well, this is actually right. So congestive heart failure is when your heart doesn't pump properly or works at higher pressure. This leads to a 5-year mortality of 50%. These took people that were hospitalized and let them be treated in a normal fashion or infrastructure over a period of about six weeks or so, where they had multiple visits to see physicians and nurses to get you onto these pillars of therapy. So we have these pillars of therapy that are really protective. One's called beta blockers, one's called the renin-angiotensin system, one's called aldosterone blockade, and a 3rd one is called SGLT2 receptor antagonist, which I don't think was part of this trial. And simply by rapidly titrating medications over 180 days, you had a dramatic reduction of hospitalizations or dying from congestive heart failure, 23% versus 15%. So it just tells you that, it's not, you don't want to just getting the medications on board, you need the right doses and the right monitoring system. And that takes time and effort. That includes blood work, including having a blood pressure machine. One of the tools that people should think about is that you should invest on a good pair of running shoes, a good kitchen knife for cutting your vegetables, a good bathroom scale, good blood pressure machine. I find Fitbit to be wonderful, looking at my steps and things of that nature. So, you should think about how to monitor your health and to work with the healthcare team. And this translates to a mortality benefit not being in the hospital. I had to be in the emergency room twice with family members over the last year, and waiting 16 to 24 hours to be seen is no fun. And this is kind of how this can be decreased. So think about that. Thank you for sharing that slide. Very important.
I think so, yeah. Yeah, for sure. All right, so moving on to today's discussion. So the team and I came up with just for the start of the new year, as people are developing their New Year's resolutions, we thought we'd help everyone at home with their health resolutions. Talking a little bit about, firstly, the common health resolutions, how you can improve your health for 2023. Secondly, why resolutions fail. So the common kind of pitfalls that a lot of people fall through that prevent them from following up with their resolutions. Thirdly, what really makes a good resolution, which is a tough question because it's a fine balance between, as we'll talk about, challenging yourself and setting out those realistic goals. And lastly, we'll provide you guys with some resources for success, things that can allow you to get accountability either with other patients or with volunteers, as well as how you can improve your resolutions in the long term. So moving on to the next slide, it'll be, so we're first talking
I'm
about.
so sorry, I got kicked out again.
Oh,
Technology. What was the last thing I said before we lost me there? Go back. Did you hear? Did we hear the front? Did I conclude this one properly? Did everybody hear the conclusion of that?
yeah.
Okay. So think about this. I'll say this again. Being on the right dose at the right time with the right monitoring system is crucial to your survival, your quality of life. And if you think you know more than people who spent their entire life figuring this out, good for you. This is something that I'm learning how to do this better. Will I get this perfect? No. Do I know what I'm doing? I spent a lot of time thinking about it and want to work with you, and so have other physicians as well. Use experts. Okay, next slide, please.
So again, that was the table of contents. We'll be starting out with the common health resolutions. So next slide, please. So the first one is a pretty obvious one. It's increasing physical activity. So as we've seen, sitting too much has a negative effect on your health, and it can be linked to mortality. And one of the things that we will try to do throughout this presentation is to provide you guys with helpful strategies or example resolutions of how this could look like in practice. So for example, this can look like a 15-minute walk at lunch, or getting up and walking 5 minutes every hour, whether you're at the office or at home, however that might look, just getting active in some way. And a cool part of this is to find a physical activity that you do enjoy. And it doesn't have to be signing up for like an expensive gym membership. It can be as simple as a 30-minute nature walk, a bike ride, or a jog. And that has health benefits of its own, just being outside. So a helpful strategy that the team came up with was to set an attainable goal. So something simple like walking 3 days per week rather than every day at first, and to see, follow up with yourself, kind of self-reflect, like, how am I doing with this? Have I achieved the goals that I wanted by the end of this week, and how can I move forward? Next slide, please. And before I get to my second point on dieting, this is just a note on dieting and fad diets. And fad diets are essentially plans that are sold as the fastest or the best approach to losing weight. And we've all heard these. They usually involve us eliminating foods that contain necessary nutrients, oftentimes, to our body, nutrients that we need to be healthy. And they usually involve too much or too little of a certain food. So examples of this can look like a high fat, low carb, or high protein diet. And without receiving the right amounts of nutrients, you can develop health problems. And an outcome of this is that once the fad diet is stopped, oftentimes the lost weight is regained quickly, and it's seen as unsustainable. So a helpful strategy that the team and I found was to exercise regularly and to eat different unprocessed foods in moderate proportion. And the moderation aspect of it is key here, where we're not completely cutting out a food group that's necessary for us, but we're moderating ourselves. And of course, this is individualized to everyone. So talk to your doctor before starting a diet. So next slide, please. So again, this idea of dieting, one thing that we found was the importance of eating more whole foods. So this involves vegetables, fruits, nuts, seeds, whole grains, and fish. And this can significantly reduce your risk of heart disease, increased weight, blood sugar levels, as well as type 2 diabetes. So there's a whole range of health benefits that come from prioritizing whole foods into your diet. And something that I think is underappreciated when we talk about diet is sweetened beverages, things like pop, Coca-Cola, Nestea, whatever it may be for you. Gradually cutting back on those sweetened beverages has been linked to an increased or has been linked to a decreased risk of obesity, fatty liver, heart disease, insulin resistance, and cavities. So a helpful strategy for the diet portion of this resolution is to slowly, again, and consistently integrate the whole foods into your diet. And a key point here is to rely less on convenience foods, things like snacks, packaged chips, frozen dinners, and fast foods, things that are easy but are ultimately not good for you. Next slide, please. So that's where we come to grocery shopping. So when we think of grocery shopping, we often think of going to the supermarket or a farmer's market, and I think doing so on a regular basis is important. So fruits and vegetables, again, they protect us against illnesses like heart disease and diabetes. But to the part of about last slide here where we talked about convenience foods, the importance of home cooked meals can't be understated here. It's really important. So there was a study done with 11,000 adults, and they had those who had over 5 home cooked meals a week were 28% less likely to be overweight than those who ate less than 3 home cooked meals a week. So the look for is here when we talk about what to shop for are rich, nutrient dense foods that are less processed and sugary. And again, the upshot here is to grocery shop regularly and to choose the right foods here. So scheduling in time to grocery shop and putting that in your calendar so you don't forget is an important step to take here to maintain this resolution. Next slide. So fourthly, it's practicing self-care. So this can involve a couple of things. Firstly, it can involve to limit your screen time. So as we've seen so much nowadays, social media, phones, computers, TV, these are all linked with depression, anxiety, loneliness, a range of different negative health benefits that can impact us one way or another. And by limiting that screen time, we're able to boost our mood and enhance our productivity. And different ways that we can manage stress. So things like meditation. There are plenty of books, podcasts, apps that can teach us about how to start meditating and to practice mindfulness. And I'm not sure if we still have at the clinic mindfulness club, but this could be a great opportunity for you to get involved with meditation or practicing mindfulness in your daily life. Lastly, with regards to health, self-care, to try a new hobby. And research has shown that just doing a hobby that you enjoy can help you live longer and healthier, and really increase that longevity. Next slide, please. And
So before you move on, is
Oh.
that we have we have wonderful videos on mindfulness, meditation, exercises from chair exercise. We also have a group that's meeting every Wednesday at 7 o'clock on Zoom. You can sign up through the clinic or through the website, and I'm surprised how few people take advantage of this. It's such a wonderful group. We have our group on Tuesdays for weight reduction. Wednesdays we have our mindfulness group. We're getting back to our cooking group, and yeah, take a look. So thank you for sharing that. Go to the website. What's that website called again, Daniel?
drcurnewhealth.com. Yeah, it's memorized.
drcurnewhealth.com. All right.
All right. And so number 5 here is reducing alcohol consumption. So we've seen how alcohol can fit into a healthy diet. But again, that theme of moderation that we talked about before, where too much could negatively affect your health, increasing risk of liver and heart disease, according to the CDC. And it's been shown that frequently drinking can prevent you from reaching your health goals. Again, in terms of that the ability to stay motivated and to kind of continue with the resolution that you've started. So some tips for reduction is, as always, to set a reasonable goal, nothing too lofty. Something like drinking only socially or on the weekends could be a good start, and replacing potentially an alcoholic beverage with a mocktail or a non-alcoholic drink could be a good start as well. Next slide, please.
Hold on, backtrack a little bit. So we've learned a lot since then. So when my mother had us as kids, I lost a bunch of IQ points because my mom was told to have the drink. So then alcohol is no good for pregnant women. It's no good for anybody. It's a type 1 carcinogen. It causes atrial fibrillation. It accelerates dementia, hypertension. It's associated with 4 to 6 cancers. So basically, the recommendation is the best amount of alcohol, unfortunately, is 0. So the recommendation right now is 0 to 2 drinks per week. I'll repeat that. The recommendations for alcohol consumption right now, this is relatively brand new, is 0 to 2 drinks per week. It annoys me tremendously, but those are the recommendations. So you can say, listen, okay, Dr. Curnew, I get it. It improves my quality of life. I enjoy it. Doesn't matter if I have more cancer, more atrial fibrillation, more heart disease, more dementia. I'll accept that. And liquid calories make it harder to lose weight. And so there's a great video to drink or not to drink. Encourage you to take a look at that. And that's relatively new information. And I didn't know that a few years ago. You should know that too as well. So we'll keep learning.
So another common health resolution could be improving your sleep. And sleep is really crucial for your health. And there has been studies that have shown that a short sleep duration, such as less than 6 hours per night, is associated with various negative health outcomes, including diabetes, hypertension, coronary artery disease, cardiovascular disease, and obesity. So currently the recommendations are to aim for 7 to 9 hours of sleep per night, ideally between 10 p.m. and 7 a.m. to kind of correspond with the daylight. And so some tips to improve your sleep could include not having any light at night. So you could have dark curtains or ideally blackout curtains, and then not going on your phone or not seeing too much light before you go to sleep. So it's recommended that if you're aiming to fall asleep by 10 p.m., perhaps you would dim your lights at around 9:30. It's also good practice to avoid caffeine and alcohol at night because this can also disrupt your sleep. And then good ventilation, mattress, and temperature control can be very helpful. And it's recommended that you sleep at a temperature between 15 to 20 degrees Celsius at night, because naturally our core body temperatures do decrease at night. And also going to bed and getting up at the same time every day, including weekends, can help build this routine for you and make it more achievable. As well, early morning sunlight exposure can help regulate your circadian rhythm to further foster this routine. Reducing napping during the daytime as well, so that you're still tired by the time that you aim to go to sleep at. And then limiting drinks in the evening, so to prevent washroom visits during the night.
Okay, great. Thanks, guys. So now we're going to be talking about why resolutions fail. I've definitely run into this cycle a lot of times during the many New Years. But I think oftentimes we get into the cycle of starting a new year, setting new goals, but then we quickly fail at these goals. And then that makes us feel discouraged, less motivated to start new ones. So in the next couple slides, we'll be going over why most people don't keep their resolutions and how you can avoid this in the future. So the first thing that we want to talk about is goal-oriented resolutions versus process-oriented resolutions. So something like a goal-oriented resolution is, I want to lose 20 pounds this year, or I want to not eat any junk food in the month of January. So you can kind of see the problem with this because it's not really encouraging you to think of how you're going to achieve these goals. Something that is more likely to make you stick with your resolutions is if you not go into the goal blindly and you come up with a plan of action. So this could look something like, I'm going to go to the grocery store on Saturday and buy a minimum of 5 healthy fruits and veggies to use when I'm cooking. And maybe that can help you with the goal of eating healthier in the month of January or throughout the year. The next thing that kind of goes along with why resolutions fail is your goals don't align with your current lifestyle. So if you're incorporating going to the gym, or you say to yourself you're going to go to the gym 5 times a week as your resolution, but you're an extremely busy person who has a job and 5 kids, think about reframing it so it can fit in with your schedule. So this could look something like, on the weekends when I'm free and have a couple of hours, I'm going to go to a yoga class, or I will go to the gym for 30 minutes. And that could potentially help you to succeed in the future. Third thing that we want to talk about is that you don't really have a proper support system and you're doing this alone. It's important to have a support system because it gives you motivation, and maybe the people in your life can encourage you to continue on with your goals. And because so many people are watching you accomplish these goals, it kind of encourages you to keep going along with that, especially maybe during the year when you get less motivated. So an example of this would be to tell your family or your friends, or maybe your gym trainer, or even doctors like Dr. Curnew, to help you best support yourself during this time and get closer towards accomplishing your goals.
So some other reasons why resolutions fail is because of the all or nothing mentality, where success is measured as either a complete win or a complete failure. So it doesn't even accommodate for even the slightest slip-ups. And I think it's important for us to celebrate the small wins, especially when we're first starting a resolution, because it is a win. It is a change in lifestyle in a way, and I think it's a part of the process, and it's progress moving forward. So to discredit yourself by saying you haven't reached a goal by a certain time, but not think of all the different ways that you have gotten closer to that goal, isn't doing yourself any favors. And one of the other things that we found was detrimental to a resolution was that it's not specific enough. Goals really need to be actionable. So you have to know exactly what you're supposed to do, when you're supposed to do it, and how you're supposed to do it as well. So if that, if the goal is to eat healthier, how are you going to do that practically? How's that going to look like for you individually? So I think those are some considerations to make, and they have to be measurable as well. Are you able to kind of measure the success in relation to that end goal, if there is an end goal? Yeah, there's some other ones. Next slide, please.
So another common reason why resolutions may fail includes not tracking your progress. So by journaling your progress, you can see how far you've come, and then this can also serve as motivation. And it helps you reflect on whether your goals are realistic and whether they're also achievable. And maybe they're not, and then you realize that, and then you can adapt accordingly and receive the additional support that you need in order to achieve the realistic goals that you do set. And this can take form in various ways, such as a journal, videos, photos. You can really be creative with it. And so, for example, if your goal for the new year is to start running every day or a couple times a week, you can track your steps, your mileage. There's plenty of apps available to do that, or you could also just write it down if you know your routes that you take. And then another common reason why resolutions may fail is not celebrating milestones. So celebrating milestones helps to serve as positive reinforcement for your goals, which can motivate you to continue working towards them. So going back to the running example, maybe your goal is to be able to run 5 kilometers by the end of the year, but you currently can't run any kilometers. So maybe the first milestone would be running your first 1 kilometer. And then perhaps celebrating this could be purchasing a new running shirt, and that can help serve you to motivate you continue working towards that goal.
Yep. Thanks so much, everyone. Now we're going to move on to the next section, which is what makes a good resolution. So essentially everything that was talked about in the last section, but in the opposite light. So how can we make a good resolution, and what are some things we can consider when making our resolutions so we have the best chance of achieving our goal? So we go to the next slide, please. Great. So the first thing that we need to consider that was already mentioned is we need to make sure our goals are achievable. So it's something that we can actually integrate into our lifestyle. So for example, if I were to start exercising 5 times a week from exercising not at all, it'd be very unlikely that I'd accomplish that goal and stay consistent with it. Another thing we need to consider is that if our resolution is actually rewarding to us. So if we're trying to achieve something that's really important to us, it's much more likely that we'll remain motivated throughout the year. Another thing we need to consider is if it's specific. So again, this was mentioned, but although our resolutions can be broad, for example, I want to be healthier, your goals to accomplish that should be specific. For example, specifying concrete goals, like I'll go for a walk 30 minutes 3 times a week, can help you make real progress towards your resolution. The last thing that was also mentioned was we need to make sure they're measurable. So this goes along with how we can track our goals and see our progress. We need to make sure that we have goals that we can track and make sure that we can achieve. So we need some way to specify how we're going to achieve that. If you just go to the next slide. We're going to talk about some helpful strategies for setting goals that are more achievable. So these are two commonly discussed things, especially SMART goals, which are commonly discussed in educational and business management settings. So SMART goals are those that using a criteria, which we'll get into on the next slide, to help make them more likely for us to achieve. And our habits are also really important to consider when making resolutions. A good resolution and all of the goals related to it should consider how our habits affect our new goals. I'll get more into why they're important and tips on how to change habits in the next few slides. So again, SMART goals are those set using the SMART criteria, and that's an acronym for specific, measurable, achievable, relevant, and time-based. So we have discussed these in previous slides, but I'll go into them again. So specific, like I mentioned earlier, it's okay to have broad resolutions, but we should break those down to more specific goals so we have a clear plan of how to achieve that. Measurable, our goals should be measurable so we can track our progress. If we have nothing to measure, it's a lot harder to know if we've achieved our goal and how we're progressing towards it. And seeing tangible progress can also help us stay motivated, which is really important for achieving your resolution. They should also be achievable, and although it's good to challenge yourself, make sure that your goals are actually achievable. Aiming for something that's really hard to do and making little progress can be discouraging. So you should tailor your goals to your lifestyle, preferences, abilities to foster growth and progress. Your goals should also be relevant to your needs and values. So I also mentioned this earlier, but your goals should be relevant to what you really value, and your goals should align with that. So working towards something you're passionate about is motivating, and that's really important again for sustaining your progress. Your goal should also be time-based, so creating a timeline for progress will help you stay on track. And so reserve regular times in your schedule to work on your resolution. So habits are also a really important consideration, and they're a really important part of your everyday routine. So habits are pretty automatic behaviors that we engage in without thinking much about what we're doing. For example, a common habit is just waking up every morning and making a coffee. So surprisingly, our habits can account for a really large % of our daily actions. A study by Dr. Wendy Wood, a psychologist at the University of Southern California in 2002, found that 43% of our daily actions are habitual. So as you can see, trying to change our habits and daily routines are really important consideration for our resolutions. So current theories about learning behaviors and forming habits suggest that habits are formed in kind of a loop shown on the left there. And so where something catches our attention, and based on our emotions, thoughts, and experiences, we'll respond to it with a thought or an action. And our response is reinforced after that, and we'll be more likely to do it again. And that's when we're presented with a reward or something satisfying. For example, say it's lunchtime and you're in a food court, a really bright sign for a fast food restaurant like McDonald's might catch your attention, which is the cue, and you'll feel like eating fast food, which is your craving. So you'll buy food from there, which is your response, and you satiate your hunger with a tasty burger, and that's the reward. So next time you go to the food court for lunch, you might crave McDonald's a little bit more, and this process continues until it's almost automatic. So you can see how habits might contribute to the formation of really bad habits, and how it might be able to help us when setting new habits or trying to achieve our resolutions. So in the next slide, we're just going to talk about how to change our habits and create new good habits. So you'll need to target parts of the habit loop, and that's a common way that we talk about now in behavior sciences to establish new habits, and this can help you achieve your resolutions. So to establish new habits and help you achieve your resolutions, you can make the cue obvious. So that's the first part of the habit cycle. For example, if you want to start exercising more regularly, you can leave out your exercise clothes and running shoes to help remind you that you should go exercise. You can also target the craving aspect by making the activity more desirable or enjoyable. So that's things like maybe listening to your favorite music or book while exercising. Similarly, you can also target the response by making the activity easier to complete, and the reward by including a reward that's more satisfying. To break a bad habit or old habits, just do the opposite. So make the cue hard to encounter and make the activity or reward unenjoyable. So if we can move on to the next section, we'll talk about some resources for success.
All right. Next slide, please. All right, so this is just a TED Talk that we found, and this is from a grade 11 student, actually from Toronto, and he's talked about his experience with starting a resolution, and he based a lot of it in research. And it's a 4 to 6 minute watch, I think, Daniel. It was around that length of time. We could just start like the first minute or so. It's a quite an interesting one. We recommend you watch the whole thing.
A little while back, I was walking on my way from school to home, when I suddenly realized that
is there
I had
any
a
audio?
1,000
I'm
word
not sure.
paper due the very next morning.
Okay. Yeah. Sure.
So in a panic, I ran home, I sat at my desk, and I stared blankly at my computer screen. To be perfectly honest, I wished I could be anywhere but here, doing anything but this. So I sat there like a rock, waiting for magic to happen.
Can you guys hear?
Waiting for inspiration to just hit me. Unsurprisingly, it didn't.
Perfect.
Now, as any reasonable person in my position,
Yeah. Definitely.
Wonderful.
All right. So once we've got done with the TED Talk here, again, sign up for our newsletters. So these will get you access to the YouTube videos every week with the webinars that we post. So you'll have the Zoom access and a lot more. So this is again drcurnewhealth.com. You can sign up to our newsletter there. Just all we need is your first, last name, and your email address. All right, and here's just a huge shout out to all of our different groups. So we've got the mindfulness, meditation, and movement group, which we had mentioned earlier. They meet Wednesdays at 7. The Sugar Club for diabetes management, first Saturday of every month from 9 to 11 a.m. Losing 30 pounds in 30 weeks, rotation across various focus groups. Smoking cessation and breathing better, those meet Tuesday afternoons. Plant-based dieting, we mentioned changing your diet, grocery shopping. Again, this is a group that is able to meet and have that accountability with, and the weight loss club. So I think what's important, the takeaways from our presentation and the repeated themes here have been to find a core group to meet with and to be accountable to. And this is a great way to get started. If you don't have someone to talk to or to share your resolution, your journey with, this is a great opportunity to meet with other patients, to meet with students like myself and members of my group who are able to follow up with you and support you in that way. And again, all of these you can sign up to them on our website at drcurnewhealth.com under the groups focus groups section, I think. Yeah. Perfect. All right. And that's it for today. This was a presentation from the Metabolic and Resilience Club. We hope you guys enjoyed. And if you have any questions, you can for sure email us at our email at drcurnew232@gmail.com.
I think that was just wonderful. And I think what we're trying to do is we're going to try to put a bridge of in-person outpatients, reading, learning, doing different things. Yeah, I think like I'm on my way to hockey. I'm going to be late. What else is new for me? And so if I can do it, you can do it. Tomorrow I'm going to be playing squash at 8 o'clock tomorrow. I can do my physiotherapy. Let's do it. Let's be healthier. I'm taking my medications. You are too. Lifestyle changes. What more can I say? Have a great night, everybody.